from your perspective, what are the unique challenges facing a PM or a product leader in behavioral health tech?
I think one of the most unique challenges, I think it just comes down to learning how to leverage and incorporate your clinical partners in delivering your solution. So if we're coming as product managers or designers from not the health space into the health space, there's just a key new stakeholder that you have to learn how to incorporate into everything you do. I would often say that we can't build a product in health tech without our clinical partners. And I think that's entirely true. The majority of us coming into health tech from as a product manager, as a designer, UX researcher, data science, we do not have clinical backgrounds largely. Some people may, and that's fantastic. But the clinical research that we can leverage is amazing. We're delivering clinical care in a digital format. And in order to understand how to do that and what works, we just need to become experts at leveraging our collaboration with those clinical teams.
Excellent, thank you. And Gabe, what's your take on that?
I would say, well, first of all, just to add to that, I think that some people wanting to enter into health tech from outside of health tech, maybe consumer backgrounds, don't think to have they think maybe I need a technical co-founder and a business co-founder, but I think really it's important to have a clinical co-founder or a clinical member of the team from day one to really get that input and really embed them into the product development process, and ideally not just have a consultant that's clinical, but really have them as a core part of the product or of the org structure from day one. I think that sort of also adding to this idea of what's different between, say, a consumer or SaaS product is that we are not the users oftentimes. So we're building a intervention for adolescent depression. Maybe one person on our team had adolescent depression, but generally, none of us are adolescents now, and thankfully, we don't have that diagnosis right now. And there are some fundamental cognitive differences, for example, differences in engagement. So to that end, really incorporating co-design is also really, really important, and really leveraging qualitative research, perhaps much more than might otherwise be used in other industries for product development.
That's super interesting. I'm going to circle back to that. Atul, do you have anything to add to those responses?
Yeah, no, just to build on what Davina and Gabe said, so 100%, agree with what they said. And I think to build on Davina's point, really, a product person in digital mental health has to hold multiple perspectives at one time when they're building a product. What we're building at Fountain House, for example, is in some ways a three-sided, a platform. And so it has to serve, obviously, first and foremost, the patients, but also has to keep in mind, as Davina said, how do the providers look at things? And really even not just kind of their motivations and their incentives, but really making sure this product fits into the clinician workflow. If you look at a primary care physician or a psychiatrist, time is the most valuable thing to them. And this has to be really easy and sort of a frictionless plug into their workflow. And then, of course, we can't forget the health plans, so the payers, who oftentimes are paying for these products. And so you have to hold all those different perspectives in mind as you're building the product. And to build on what Gabe said about, this concept of, for sure, for example, I'm working in the space of serious mental illness, and though I have family members who live with it, I myself don't. And so this concept of human-centered design, which of course now is kind of common parlance by now, but really doing that and incorporating the patient perspective from day one into these products in a way that builds, the trust that you need and the engagement that you need is incredibly important.